And we are here with sippy cups and sanity checks. I am Crystal Endress, the pediatric nurse practitioner and lactation consultant, speaking with...
I'm Kaley. I'm a stay-at-home mom asking the questions that are on parents' minds.
And we're helping keep your cool and your coffee warm.
I'm a pediatric nurse practitioner, and while I bring clinical experience to these conversations, this podcast is meant to educate and not replace care from your child's healthcare provider. All right, so for this episode, we are going to talk about sleep training and what that looks like. So, Kaley, take it off. Take it away.
Hey, sleep training. What is it, Crystal? What is sleep training?
Training your babies to sleep.
Mine was broken then. I wasn't a very good learner.
I'm going to say this right off the bat, actually. If your child's not sleeping well at night, it's probably because they're not old enough yet. So your 2-month-old should not still be sleeping well at night.
Yeah, they shouldn't sleep through the night.
No.
I gotta wake you up.
But if they're 4 to 6 months old, we can work on it. Now, there can be other factors that come into it, like an illness. But at 4 months of age is when you can start sleep training, meaning you can start some healthy sleep behaviors ahead of time to help them fall asleep faster and have a better night of sleep, more full night. And that can be 6 to 8 hours.
So you're talking like establishing a good bedtime routine?
Yes.
Okay.
Yep.
Perfect. So
not taking 6 to 8 hours to establish that.
Yeah. Ooh, man, buckle up.
Oh, yes. But sleep training refers to behavioral strategies to help your infant and toddler learn to fall asleep independently without a mother or a father or mothers or fathers, grandparents, without a
guardian present,
without a caregiver present. And that is not rocking them to sleep. That is not needed after 6 months of age. So that is what we're going to talk about, is the sleep training. All right, let's do it. Okay. What's your question?
So if I sleep train my child, is this going to be psychologically damaging? Are they going to grow up? They're going to be emotionally stunted, and we're never going to have any emotional maturity.
If you completely abandon your child.
Okay.
100%. But that is not the short-term sleep training that is going to do that. That is specifically if you are abandoning like all of their needs in general. So no, it is not going to be psychological damage to them. It is not going to cause them anxiety or depression when they're a teenager.
Okay. So that won't be the reason they need therapy.
No. Maybe some other reasons.
Okay, got it.
So methods that are for sleep training can vary per family. That works for them, I should say. But when we talk about negative psychological effects in children, that is more related to low parental sensitivity. That's also related to high parental stress or mental health problems. These are the things that we really need to focus on that could cause negative psychological harm to our children and our babies. So ensuring that the parents' stress factors and mental health are actually up to par versus focusing on the impacts of what a short-term sleep training could do versus chronic stress in the home that could actually impact the infant's psychological stress or effect as well.
Okay, so like what are different types of sleep training? Like I've heard of the Ferber method. Mm-hmm. Can you tell us a little more about what the Ferber method is?
Ferber method I actually do like, and I have seen very good evidence behind that being done efficiently. Ferber method is not the cry it out method. Just to clarify, when people hear cry it out, they think Ferber method too, and it's not. Ferber method is where you do place your infant to sleep, but you place them when they're half awake, like drowsy. Place them in their crib, You walk out of the room. I mean, you do your little like, good night, honey, you know? And then you walk out of the room. They start crying, begging, Mom, Mom. I mean, they're not talking at this age.
You have a really advanced infant.
6-month-old.
When they see their first
Mom.
That's when you celebrate, you throw a party, we sit bedtime routines out the window.
Come back to me.
Mama. Wah.
You immediately want to go in there and be like, honey, it's okay. I'll soothe you all night long. That's not the case. So Ferber method, walk out for 1 minute, let them be upset, cry, come back in. Don't touch them. Just tell them everything's going to be okay. It's time to sleep. Walk out. You just extend that time every 5 minutes or so. And you do that for a couple nights in a row. And you'll start noticing that the baby will actually make those increments a lot less frequent. So say it went on for like 30 minutes to an hour one night. It will then go to 15 minutes, and then it will go to 5 minutes, and then they'll fall asleep. It's really just teaching them that they can self-soothe, and that is all that you're doing at that point. And it is not trauma. So them crying is not trauma. And that is the Ferber method. I do like to tell parents that consistency is key. Anytime you're doing a new rule, a new discipline of any sort, and that is consistency. And that is for both caregivers as well in the household that are trying to implement the discipline. So if your child is fighting back, not wanting to do that sleep or bedtime routine anymore, make sure that you stay firm. And say they are sick or something else is going on, yes, you definitely need to care and comfort them during those times, but get back to that consistent bedtime routine once they are feeling much better. So what studies have shown with different sleep training methods like the Ferber method is that there have been some studies saying there's no difference in the attachment, security, cortisol levels, and their emotional behavior outcomes, even up to 5 years of age. Parents have actually often experienced improved mental health and sleep, more for themselves. So that's good. Don't let your baby sleep with you in your bed. I'm just going to say that. It is not necessary. It is unsafe, especially up to a certain point within the first 2 years. But there are different ways if you want to have your baby in the room with you during that sleep training process. They should be, still definitely in a crib in the room per the American Academy of Pediatrics up until 1 year of age. And if you want them close by you to your bed, there are attached cribs or methods you can do that attach to the bed, but it's still safe for your baby. So know that that is an option. All right. Next.
Okay. So we talked about bed routines a little bit, but why is it important to establish a bedtime routine?
So for bedtime routines in general, it signals, so it's a predictability for them. It's a routine, something that actually can keep them and make them feel safe so they know what to expect for the next step. So bedtime routine should start around 4 months of age to that 6 months of age. If not, it can always be started later. Just know it's never too late to start a bedtime routine, but the earlier you start it, the better off it will be and faster for them to fall asleep faster and actually stay asleep. And what a bedtime routine can look like is anything that is good for your family. So that is, if you think reading a book every night is something that you can stick to, read a book. If it's 2 or 3 books that night, if it's a bath every other night, but sticking to that routine. So is it bath, book, blankie, stuffy? Is that just a book and prayers? Is that a book and singing? Any way to, or even if it's like a nice little massage or getting the body to stretch before bed, like starting that at that 4 to 6 months is going to be key. Now, if you're starting at 2 to 3 years of age, you can still start it and that's fine. It's just going to take probably longer, weeks at a time, probably, to have them adjust to that and anticipate that. But the earlier you start, the better.
So your blanket and your stuffy. What age can you introduce your blanket and your stuffy?
At 12 months of age, because this is where the risk of sleep-related suffocation has actually substantially decreased. To maintain warmth, wearable blankets or sleeper clothing are preferred over loose blankets until at least 12 months of age. And it is generally considered safe to introduce the small blanket or soft toy if they are developmentally appropriate to move the objects away from their face and the sleep environment remains safe otherwise. So it can look different for other children, but normally the American Academy of Pediatrics states at 1 year of age, 12 months, to introduce that just to reduce the risk of suffocation or entrapment related to stuffies or blankets or loose items in the bed.
Okay, so we talked about the importance.
Mhm.
We talked about a good example. So another hot topic in the TikTok world right now
Oh, tell me.
is when my child is older,
Mhm.
is it a good idea to use nervous system regulation as part of my bedtime routine before bed? In my house, we call them the bedtime zoomies.
Mhm.
When your kiddo just gets super, super hyper before bed. I've
Mhm.
seen stuff where like they do heavy pressure, like big tight bear hugs. They
Mhm.
do like arm and leg squeezing. We
Mhm.
do jumps or like claps,
Mhm.
pats, all these things. So what is it? Is it good? Is it effective? Do we need it?
Very good, very effective. I would honestly tell parents to do this more than going to melatonin, more than trying sleep medications, more than trying to blame something else on why they're not getting sleep. So, this is very helpful. And examples can be like deep breathing. So, actually teaching your child to do these things now and before bed can help them even regulate their emotions during the day. Doing like body scans. So people call them body scans, but just like talking through your body as I'm touching your arm right now. So like this is your arm and squeezing the back. So like what you were saying is squeezing the thighs, squeezing the legs. You're doing like a body scan. Kaley is trying to hold back her laughter, and I really don't want to know where her mind is going with this right now. So I'm going to move forward and say there's gentle stretching, there's mindfulness, but not only will this benefit bedtime routine, getting the zoomies out, it also will benefit helping them learn how to do this also during the day to day. Like if you incorporate these cool skills now to help soothe, they'll start learning these things too.
Sweet. So
Mhm.
all these things put together,
Yep.
sometimes bedtime routines include sound machines.
Mhm.
How do I safely use them?
The best thing to do with sound machines is make sure it's at 50 decibels or lower, which is like a light shower, or if you're hearing a rainy day with the window closed. That's where the sound needs to be. It does not need to be on or in the bed. It needs to be far away from the bed. I worry about them being too loud. There are sometimes I hear these sound machines and they are intensely loud. And I'm like, that is not necessary. It's more damaging than it is beneficial.
When you say damaging, you mean to their hearing?
Yes, damaging to their hearing. And often too, they're like continuous throughout the night. It does not need to be continuous. I would only set it for about an hour and then have it turn off. So that's why also a lot of the sound machines do have set timers on them, but also a lot of the apps now these days have the decibels on it. So making sure that you have it at 50 or below.
Alrighty.
Mhm.
So are they recommended?
Recommended, not necessarily. Now, if you live probably in a city with lots of trains or things that might, or a dog that barks throughout the night, that can impact the startle reflex that can then end up waking up your infant. But the startle reflex goes away around that 3 to 4 months of age. So recommend not necessarily, but if you feel like your baby does fall asleep well to that sound machine when it's at the appropriate decibels and the appropriate length it is away from the crib, which is around 7 feet, then go for it.
Okay. So a hot topic on TikTok right now is, are sound machines damaging to cognitive development? A lot of people are saying that it causes a fight or flight response in babies and toddlers.
Absolutely not. No. I'm curious, like, where that came from too, like, what the logic is behind that, unless they have I don't know, I'm just trying to get creative here, unless they have the sound machines doing, like, weird noises or saying horrible things or murder mysteries. I don't know. Gunshots? I don't
There's a thing going on right now that they're saying the hatch is demonic. Have you seen this?
No, I haven't.
You should watch some of these videos.
This is why we're doing this, because I had no idea the hatch is demonic.
Not the portable one, the one with like the lights. That hatch. There's
What's demonic about it?
I guess they're saying it like makes weird noises in the middle of the night or like flashes red or something.
Okay.
Yeah. They're saying that
there's lots of things going on with it.
Yeah.
So don't get ones with lights then. Just not even hatch. Just don't get it with lights. Or just get rid of the sound machine. It's really not that necessary. As long as you are incorporating a good bedtime routine to help your kid fall asleep and stay asleep, just don't use any of these extra things. I mean, what did the kids do in the 50s without all these things? They still slept just fine.
They hardly made it, Crystal.
They hardly made
Everybody was sleep deprived, but happy.
Oh, they actually played more too throughout the day. So,
okay, next question.
Yes.
Lavender. Okay, lavender's calming.
Oh, I love the smell of lavender.
Yeah, same girl. I hit that up every night. I sure do. That's part of my bedtime routine. In my house, we call BTR. Yep. Gotta do my hit of the lav. Anyway,
love it.
So, is lavender safe to use on boys? Is it safe to use on girls?
So I'm not going to be discriminatory here. Both safe to be fine for girls and boys for the scent. The scent.
Okay.
The chronic exposure, not the occasional exposure, can cause gynecomastia.
Okay, and what is gynecomastia for those that don't know?
So gynecomastia is where the breast buds do get enlarged. And this can be decreased once it's stopped or being discontinued.
Okay. So it's a reversible gynecomastia. So they're not going to have permanent looking breast tissue.
Correct. Yep. So the evidence is limited, but AAP, so the American Academy of Pediatrics, recommends do not using essential oils on your child. There is a difference between topical exposure versus environmental exposure. And this is important to know too. So for girls and boys, it is not recommended safe when we're using it for direct skin contact or topical exposure. As far as fragrances goes, like in the air, that is fine. If you have a candle or something like that, that is totally appropriate. Yes, but not using on your child.
Yes. And I heard the same thing about tea tree oil. Is that the same thing as lavender?
Same thing.
Gynecomastia?
Yep. So same thing. Any essential oils should not be applied directly to your child's skin.
Okay. Alrighty. Let's talk about melatonin. Okay, so what ages can safely take melatonin?
The ages that are considered safe to start for children are usually around 2 years or older, with more neurodevelopmental disorders that have been found, such as autism. But likely children aged between 5 years and older with some sort of insomnia, and only after sleep hygiene and behavioral interventions have failed. So always discussing with your primary care provider about this is very important before you start melatonin. A lot of times what I find is parents are giving it to help their child sleep through the night. Melatonin is not to help sleep through the night. It is help to go to sleep. So that is a big misconception out there. There first needs to be, before starting any supplement in general, there first needs to be an assessment to figure out if there's, just like iron, is there an iron deficiency? Is there a sleep disorder that we're not catching? So please talk to your primary care physician about that.
So I've talked to my pediatrician. They recommend melatonin. How do I choose a reputable brand? What should I look for when choosing supplements?
So you have to understand that the melatonin supplements are not FDA regulated. That meaning there can be different dosages, even though it states like there is 1 milligram or 3 milligrams in each gummy or pill, that's not FDA regulated, meaning it could be 2.5 milligrams in that. It could be 3. So it's not regulated enough to know. However, if you are truly thinking about starting a melatonin supplement for your child, we do have a safe pharmaceutical grade melatonin that can be prescribed and is strongly preferred due to the safety and dosing accuracy and the regulatory concerns. There's no specific brand that we say, yep, this is the one we trust. If you are going to use melatonin, most pediatricians or pediatric providers will say this is only for short-term use. If this is something that needs to be looked at as long-term use, then that definitely needs either a sleep study, sleep referral of some sort to see what else is going on.
Got it. So, like, what about third-party testing? Does that make it a more reputable brand?
I wish I could say that third-party testing organizations are a safer option for melatonin supplements, but unfortunately, I can't confidently prove that. There have been systemic analysis for commercial melatonin products, including those with third-party certification. So just so you guys are aware, like the melatonin content, there is variability, and I say that with there were measured doses ranging from negative 83% to additional or positive 478% of the labeled amount. Variability on the melatonin supplement that you should be taking. So if it said this is a 1 milligram gummy of melatonin supplement, that could be plus or minus by 80% to 400%. So that is such a large and accurate labeling, and that is why it's important to have something that is prescribed and talk to your physician about something you want to start versus starting something over the counter. There are additionally some contaminants that have been found, such as serotonin, that have been found in melatonin as well.
So,
Oh, go ahead.
isn't melatonin a hormone?
It is. It's our sleep hormone, so
Mhm.
we actually produce it ourselves. Yep.
Okay, so, like, if I give it to my kid, will my body stop naturally producing it?
No. Mm-mm.
Well,
No, you're
not my
just
body, their body. You know what I mean?
no. So it's not like the hormone goes away. It's just in addition to.
Okay. So I heard that melatonin can give scary dreams as a side effect. Will my child experience this?
Well, to answer this question, what I've seen in practice versus what has been studied are different things. So, melatonin is safe for use, obviously, when it's prescribed and when you have talked to your provider. But frightening nightmares or increased like hyperactivity have not been commonly reported as the adverse effects to this, to taking melatonin. The common reported adverse effects include morning drowsiness, headaches, dizziness, rash, hypothermia in the multiple systemic reviews. What I have heard from parents that have correlated were nightmares and hyperactivity. Normally, I just say discontinue use of the melatonin product. And more times than not, it is something that they are taking over the counter. So, melatonin over the counter. And that is to answer your question. It potentially can is something I have seen being reported in my clinic, but something that hasn't been reported in studies as a common adverse effect. Make sure you have a consistent bedtime routine. Make sure you have the behavioral sleep strategies in place. So, like, if they're restless, like what you were talking about, making sure you're doing your mobility exercises beforehand and your wind down exercises. A lot of these questions will be need answers before any pediatrician will want to start a melatonin. Also, the big thing too is one thing I have forgotten to add is, like, reducing screen times at bed. Like, it needs no screens before an hour before bedtime is preferred. So,
Another question.
mhm.
So if I give my child melatonin, will it cause depression?
No, and I will say this, no confidently when it's on a lower dosage, but if parents aren't dosing appropriately and they're dosing at high dosages and chronic use, like, it can cause mood changes. So, again, talking to the pediatrician.
If I see a mood change in my child, will it happen right away or after long-term use? Like, are they gonna be irritable or super not themselves after the first dose?
No, it is actually more abrupt with the melatonin. Yeah, because
You'll
you
see it
actually
right
start
away?
seeing it right away.
Okay.
Yeah, I had to think through that one a little bit.
That's okay, as long as we got there. Okay, next question about melatonin.
Yes.
Can my child become addicted?
No. No. There has been no evidence, I should say, as far as addiction goes to melatonin, and no withdrawal symptoms either.
Okay.
So, to wrap it oh, yeah, go ahead. You got another question.
Yeah,
Go
I do.
go for it.
Safe sleep. What are the safe
Oh,
sleep
yeah.
guidelines?
Oh, I love safe sleep. I love talking about it because I think it is so important, and unfortunately, I have had some infants die due to unsafe sleep practices. So, safe sleep is for infants, babies born right when they get home from the hospital. You should have them in a crib, you should set them on their back, and you should not have anything loose in their crib whatsoever,
When you say
or
crib, you mean
stuffies.
crib or bassinet?
Yep, crib
Okay.
or bassinet, yep, and you can have them in a swaddle around that up to 2 to 3 months of age, and but no other stuffies, toys, pillows, blankets, loose blankets, nothing in that sort.
Okay, so can they sleep with a sleep sack on?
Yep, sleep with a sleep sack on and swaddled, yep.
Can they use a weighted sleep sack?
No, not at that age, especially for their little lungs. You want their lungs to fully expand and breathe.
So weighted sleep sacks are not recommended for use.
Mm-mm.
Safe sleep, what does it help prevent?
That helps prevent SIDS. They actually have another terminology for it now, but it's sudden, unexpected death. So that could be anything from wake up and your infant is purple, blue, unresponsive, but it is sudden, unexpected.
Okay. Are owlets or sleep monitoring devices harmful or beneficial? The owlet is FDA cleared.
I do believe it is more harmful for parents. And I think we discussed this before too. I do believe it is more harmful because it brings more anxiety, especially if it's not fitted on the foot right. They're kicking and moving. It can actually set off an alarm that isn't true to their baseline. Hmm. Great question, Kaley.
Mhm.
Hmm. Anything else?
My baby keeps hitting their head in their crib. Can I use bumpers?
No, not outside. No. Like bumpers in the crib?
Because
No,
they're hitting their head in the crib.
no, no, it's
What if
okay.
they're mesh?
Their mesh? No, just don't use any nothing in the crib.
Is there a safe way to co-sleep?
No, no co-sleeping with the parents in the same bed.
Got it.
Mhm. Yeah, these are great questions. We did it. Any other safe sleep questions?
Yes, there's actually just one general sleep question. A hot thing on TikTok
Mhm.
is the Taking Care of Baby Sleep course.
What is that?
Well, I didn't buy it, so I couldn't tell you what its
Oh,
contents are,
okay.
but I wanted to know if it was worth the money.
So what is it about though? Like what's the intro to it what's the incentive to buy this course?
Because your kid's not sleeping no matter what you do. And it's to get them to sleep through the night and for longer periods
Oh,
sooner.
okay. So go to your pediatrician and they'll tell you what to do too, as in sleep behaviors and sleep training. You do not need to buy any sort of course
Perfect.
to have that
You really do not need to buy any course. They're just looking for money. So that is it. And that is it for our sleep training podcast session. Thank you guys so much for listening. Kaley and myself really love hearing your guys' feedback and would really love some comments. You can actually email us with any comments or questions that you have. And have a great day.
Yeah, we'll include that email in the description. And you can also DM us on our Instagram page, which will also be linked in the description.
Yes. All right.
Take care.
Kaley and Crystal.
Howdy.
Thank you so much again for listening. And here are some of our bloopers from the episode. Enjoy.
Up there, my critical thinking skills.
They're not depleted. They're just slow.
Woo! Okay. Neurons are going and sending zing, zing, zing. Okay. Next question. Try to be with the world today. Without a parent.
Without a caregiver.
Guardian.
Forcing their child to sleep.
You or mothers or fathers. Your face.
It's a good thing you're good at this.
Trying to be diverse.
Yeah. Without
But I don't know that. That would be a really good question.
for a professional.
For a professional. Just kidding, Crystal.